So just to kind of kick us off, we want to talk a little bit about the data that's needed. So as the applicable large employer, your responsibilities as related to data. So we're looking at payroll, a way to manage the hours of service and tracking that information for those employees, particularly the part-time variable hour folks. Your census data, basic address, employee information, name, social, things like that. That's the type of data you're going to want to be responsible for. Your plan information, if you're using our enrollment system, you're probably used to hearing that. It's called the plan builder data. So you'll want to have that as well. And then enrollment information. So the offers of coverage that you make to those individuals, as well as those individuals who actively enroll and any covered dependents if necessary. Okay? So it's really important that this is accurate. There's monthly tasks as well that you want to stay up to date on. So to ensure that you're compliant, we typically recommend monitoring, again, those employees, their full-time status by tracking the hours of service. You can either use that monthly method or the look-back measurement method, whichever works best for your organization. The offers of coverage as far as the minimum essential coverage and minimum value. So for newly hired employees and calculating any full-time equivalent employees, as well as that offer to dependents. Then we also do a data suggestion for payroll, again, monitoring that payroll and tracking the hours of service, your census and demographic information, keeping up with new hires, terminations, and that type of information, along with any offers of coverage, elections, whether it's a new hire or if someone has a qualifying event and changes the tier of coverage that they have. Along with the 95%, make sure you're monitoring and keeping an eye on the 95% criteria for the full-time employees. So you'll definitely want to be making sure you're kind of keeping line of sight on these things on a monthly basis, as well as general data review at least quarterly, just to make sure that information that you might identify that's there's any errors or issues or any troubleshooting that you might have to do, you can do it during the course of the calendar year versus waiting to the end of the year to do that. Now the ACA refresher.
All right, well, thanks, Kelly. Just to give everybody a refresher on the ACA here, of course, it has been in place for about 15 years, with the employer mandate piece being in effect for a good 10 years at this point. And SyncStream has been a part of it since the beginning. They have stayed current with all of the changes in the requirements over the years. And as you can see here, ACA is not a one and done type of situation. These rules change from time to time. There are various state mandates. There are new electronic filing requirements, and even laws passed late last year that impacted the 2024 filing cycle. One of the first steps of ACA compliance is determining if you are an applicable large employer, and that's done by determining your full-time employee status. So in order to do that, you first start by taking your full-time employees. They're each going to be one full-timer, and then for all of your employees who work less than 120 hours, you sum up their hours and divide by 120, and that gets you your full-time equivalents. You add those two figures together, and that will be your total full-time equivalent count. So for this group, you can see the example here. They have 30 traditional full-time employees and then 30 part-time employees. So at first glance, you might think they're applicable large employer. They have 60 employees. However, those 30 work part-time. And so they are only each a half of a full-time employee. And so as a result, this group here has 45 full-time equivalents and thus is not an applicable large employer and is not required to offer affordable coverage. So as an applicable large employer, you are required to offer coverage or be exposed to potential penalties under the employer shared responsibility provision. There are a couple of penalty regimes. There's the A penalty and the B penalty, as we call them. But to get out from under the first penalty, the A penalty, the employer simply has to offer minimum essential coverage. And minimum essential coverage is basically any employer-sponsored group health insurance. It also includes other forms of coverage that people might have, like marketplace coverage or Medicare or Medicaid. But from an employer perspective, you need to offer coverage that is minimum essential coverage. And that really just means that the plan offers coverage for certain preventive care services. You're essentially breaking the ice and at least offering some form of group health plan coverage. And then the secondary penalty is based on whether that coverage you offer is affordable and minimum value. Which brings us to this piece. So the other penalty regime under the ACA is the B penalty. This applies when the employer offers health insurance, but it may not meet the affordability and minimum value requirements. So for minimum value, what that really means is the plan designed to pay on average at least 60% of participants' medical expenses? And does it provide coverage in certain areas? Like it has to provide coverage for inpatient hospitalization, ambulatory physician services, emergency room services, prescription drugs, and basically just be the equivalent of at least a bronze plan on the exchange. That 60%, roughly translates to a 60% actuarial value. And so it's also important to be able to identify your full-time employees. And the ACA regulations prescribe two methods for doing that. There's basically two ways under the rule. It's either the monthly method or the look-back method. Under the monthly method, it's kind of the default method. Here, you are looking at each employee on a monthly basis. If they work 130 hours or more in a month, they'll be considered to be full-time that month. And you look at each month during the year. This can be a little bit tedious to track on a monthly basis. You also may have your payroll frequencies not strictly aligned with calendar months, and there's workarounds for all of that, but it can be a little bit administratively burdensome. It's kind of easier for employers that have only full-time employees, or full-time and part-time. If you have employees that move around, that vary from full-time to part-time or vice versa, then the look-back method may be a better approach overall. The look-back method takes a look at employees' hours over a set period of time, usually what's between 3 to 12 months, and typically it's a 12-month period. The look-back is the term over which you look at the employees' hours. If they average 130 hours a month over that look-back period, then they're treated as full-time during the subsequent stability period. Typically, the stability period will match your plan year. Your standard stability period matches the plan year. So you look at employees once a year to determine their full-time status. You offer them coverage at open enrollment, and then they're basically retain that eligibility for the plan year if they worked full-time during the prior year. And then, of course, you also have the employees who may become eligible during the year as new hires. They also have their own initial look-back method that's tied to their date of hire. This is also kind of handy if you have variable hour employees and you want to perhaps stretch the amount of time before you offer them major medical coverage. This would allow you up to 12 months to measure their hours to make sure they're full-time before you actually offer the coverage to them. And there are considerations if you're operating in multiple states. In addition to the federal ACA reporting requirements, there are other states that have different mandates. Some of them require very similar reporting to the ACA forms. Some of them are slightly different, like in Massachusetts. So it's good to be aware of those requirements. And, working with Selerix will help you centralize your data and just keep an eye on things during the year, right, Kelly?
Absolutely, absolutely. So for those of you who are using our system, whether it's the integrated or the standalone, having everything in one location and being able to accommodate both the federal and the state level and having the information in, as Stacy mentioned, in a centralized location is really the best practice to be able to make sure you're meeting all of the requirements at the federal and state level. So then the final takeaways. So you really just want to spend a little time every month just checking your data. We're very big on proactiveness, right? So we want you to be proactive in reviewing the data, all of the elements that we talked about earlier in the call, making sure you're keeping up with your hours of service. And if you're doing your measurement tracking, whether it's monthly or you're doing it on a look back measured method, that you're going ahead and managing that and making sure your pay history records are accurate and up to date, your classifications for your employees, any new hires and terminations as far as demographic information is being updated as well. Again, regularly manage your measurement process, again, whether that's monthly or if you're doing it on a look back method, being proactive in that process. Leverage any ACA compliance technology if you're using the Selerix or SyncStream system to be able to manage that process, making sure you're taking advantage of any automated reports that can come to you for review in a proactive manner, or running those reports on a more consistent basis. And then obviously partner with the experienced ACA experts, those folks who are doing it. This is what we do every day, all day. And so, being able to take advantage of that and have a partner that can really help you through the process and make sure that you keep things on track and keeping line of sight on those important pieces throughout the course of the calendar year, so that when you get to the end of the year, you're really in a good position to complete the forms and filing process accurately and efficiently and effectively. Mm-hmm.